Hello everyone, my name is Zina Abdulkadir. Today I'll be going over my script narcotic surveillance application research capstone project for Mercer University Health Informatics program for Dr. Bascaron's Information 700, and this is the semester fall 2018. For my executive summary, so according to the CDC, between the years of 1999 and 2016, close to 400,000 people died from opioid overdose, consisting of both prescription and illicit pain medication. As the years go by, there's an increase of numbers of incidents where narcotic medications are being used and abused by different patient populations. However, over time, patients are becoming more dependent on these drugs. So it is a rapid growing problem in the United States and is currently being considered an epidemic by the CDC, the Center of Disease Control. So the purpose of this project is to basically better understand how health information technology is being used to fight the current opioid crisis in the United States through the use of narcotic surveillance application. I know that information technology specialists have been working really hard in implementing different clinical decision support systems to help tackle this crisis, and healthcare information and healthcare providers are playing a huge role in minimizing and preventing the misuse of narcotic substances through computerized supervision and by ending overprescribing control medication. So for this research project, I'm going to be doing an evaluation study and data collection through surveys completed by different healthcare providers under the South Carolina Prescription Monitoring Program, also referred to as SCRIP, Reporting and Identification Prescription Tracking System. And I basically will be looking at different stakeholders such as licensed professional medical personnel that actually use the system on a daily basis. So for my introduction, I'm just going to give you guys a quick background on the script application database. So in 2006, a House bill was passed in South Carolina that required that healthcare professionals such as practitioners and pharmacists use an electronic or manual form to identify the dispensary of controlled substances between different category and classes. So a registration and application must first be filled out and by the healthcare provider to gain access to the script application. So basically, this was started by the Department of Health and Environmental Control. When this was developed, it was basically the primary purpose is to reform the narcotic prescription process by basically increasing the ability of providers to identify the dispensary and basically impede the over prescription of narcotics and patients from doctor shopping, going to different physicians for different purposes to get different pain medication without that being tracked. So this script application is now required by all licensed physicians and practitioners who have the capability within their scope of practice to prescribe controlled pain medications. So basically, they register through the portal and they gain access and they're able to submit data. And even with the Medicaid, there's now being a rule implemented stating that Medicaid holders for physicians that have patients who are Medicaid holders must review the script application before prescribing any other pain control substance, or else they will basically be penalized for that. So this research study basically just does an evaluational study to analyze the script program and how it can better create more reliability and more accessibility, and how is the usability for the population that is currently using the system. So for the research design and methodology, so basically in this research project, the different providers that are using the system will be incorporated in the project. There will be a total of 25 surveys that were completed. It contained 12 to 15 open-ended questions regarding usability, performance, and convenience. And then I created a detailed report giving visual representation about the qualitative study and the data I analyzed. So within my population group, the 25 surveyors, they were consist of both men and women that are working in the main hospital in South Carolina. Based on my agreement with the supervisor, we agreed that I will not be discussing or naming the hospital in specific during the project process. So with this, since I currently do not live in South Carolina, that was kind of a limitation for this project, since did not have direct access to the script application, and I did not have directly worked with individuals who use the system. So I used a secondary source who was a good friend of mine who's currently advanced practicing nurse, and she basically handed out the survey process. This was a confidential process, and all surveyors and all participants were aware that the information gained in this project will not be shared with anyone else outside of this research project. And basically I sent out a manual paper pen form in which participants were able to fill out each to fill out each survey, and then it was mailed back to me. As a reminder, I sent out thank you letters, and I also thank you emails, and I also sent out reminders to the participants. I gave them about a week from Wednesday to the next Wednesday to complete it, and luckily, when I first started with the project, I intended on having about 28 participants, but a few participants just didn't want to be part of it. And I was okay with that. For the informatics component, so the narcotic surveillance application system were basically created to help assist medical professionals in identifying controlled substance dependencies and abuse among different patient populations. This has created a huge problem in the United States with narcotics and opioids. This epidemic is having a rise in deaths from 100 to 115 deaths per day by the CDC. So there was the development of prescription drug monitoring programs that each state must regulate within healthcare facilities, and medical professionals utilize healthcare information to better improve this problem. So for the script application, this particular tracking system basically collects, organizes, stores, and retrieves prescription medical history through the use of electronic computer systems. So basically, this system basically shows it should be available 24/7 throughout the day. It should also be open. Once data is entered, it should be available within seconds. It shows medications, controlled substances between the categories of 2 and 4, and it must also be available to all healthcare providers that are able to prescribe that medication. So for the proposed solution activity, the proposed solution for the South Carolina reporting and identification prescription tracking system includes the inclusion of Category 1 substances, since most other forms of pain control are emerging in the healthcare field and are being prescribed. I feel that should also be put into that data, and also that the certain healthcare facilities such as emergency departments and such as hospice care, long-term acute care, basically do not have access to it, since a lot of the medications for short-term use, and From analyzing it, I found that 60% of licensed medical healthcare providers find the reports to be over 48 hours, which is not one of the promising things of the application, and it's not one of the benchmarks and wants and needs of it. The narcotic surveillance application does not include the long-term facilities and departments for those dispensaries, and so on, and those things could be fixed with time. Concluding remarks: the use of narcotic surveillance application is becoming significantly decreased the abuse and misuse of controlled substances. Healthcare providers have the ability to track prescription medication, and there's basically an overall cost-efficient manner that they're trying to tackle this problem. Those are my references. My appendixes was my survey questions and permission letter, and then my project plan, which is phase 1, phase 2, and phase 3. Phase 1 is the project initiation. Phase 2 is project execution and monitoring control. Phase 3 is the project closure. In phase 1, I basically conducted research on the topic and literature review. I completed my research proposal, gained project approval, submitted my IRB, revised my research proposal and project needs, and created a project plan and Gantt chart. In phase 2, I gained IRB approval. I created my survey questions. I created confidentiality agreement forms. I hand out surveys to the participants, collect the data for further analyzation, and revise my research draft. In phase 3, for my project closure, I analyzed the project data and findings. I input the data into my research paper, finalized research paper, completed topic and findings, and recorded my presentation and submitted it. Thank you so much.